Go. Welcome, my dear audience and friends, to Cancer Convos with Grace B. This is your host, Grace B, coming to you from New York City, the city that never sleeps and is home to Cancer Convos with Grace B. Thank you all ever so much for supporting all my platforms. I'm very glad to be having these conversations with you, and hopefully you guys have been able to extract one or two things to be able to help you on your journey. So, the first quarter of 2020 has proven to be extremely difficult for health workers all over the world on the front lines of the COVID-19 pandemic. Um, for many, it has taken a toll on their work, on their family, on their relationships, and also on their physical and mental health. Those who have not been able to understand the trauma of seeing mass casualties of this magnitude have sadly taken their own lives. Now, today on this episode with me is Dr. Natalie Hua, a young, experienced resident physician and chief resident. She is a passionate and very dedicated frontliner herself. She has been willing to share her experience and give her candid opinions on the pandemic and how it has affected the lives of our heroes and sheroes. This episode today is titled Living on the Front Lines of COVID-19. So, without much ado, I welcome Dr. Natalie Hua to the show. Welcome, Dr. Natalie, and I'm so glad you could come on.
Hi, Grace. Thank you so much for having me on. I've always been a big fan of your show.
Thank you so much. Now, before we delve into this topic, please explain to us what your role as chief resident is for those who may not know.
Yeah. So I'm in the third year of training in family medicine in Central New York in upstate. And for the last year in the program of 30 residence physicians, I'm chosen to be one of the two chief residents. So it really is an honor for me to have this role. It's more of a administrative position when it comes to fulfilling day-to-day schedule or just basically a support system for the rest of our residence physicians.
Oh, wow, that's awesome.
Yeah.
So now let's dive straight into the show. Please tell us what exactly COVID-19 is.
Yeah, so this is the questions that I usually explain to my patients a lot because we do hear the name a lot, but to put it in simple term, coronavirus is also the other name for it. It has a whole family. There's many different types, and you probably have heard of other types of coronavirus in the past. In 2002, we have the SARS outbreak. The other name for it is severe acute respiratory syndrome. And then in 2012, we also have another outbreak of the same type of coronavirus called MERS, which stand for Middle Eastern respiratory syndrome. And this particular outbreak in 2019 is also another type of coronavirus. Coronavirus is actually a common type of virus, sometimes without causing severe symptoms like these outbreaks. We're just calling them the common cold, which we're all familiar with. For this particular type, the name for it is SARS-CoV-2, or coronavirus disease that has the outbreak in 2019. So the other short name for it is COVID-19. So originally, bat is a reservoir for a lot of different type of virus. The viruses can replicate inside of these animals without getting them sick. But sometimes when the virus get mutated and they changes their form, they can cross over to the human form. And this is essentially what happens in we think it started in the province of Wuhan in China in 2019, when an organism that's mutated and then crossed over from bat to human, causing us to be sick.
Yes. Oh, wow. That was
Yeah.
actually very scary, especially
Yeah.
the mutation, because you think it would just reside with the bat, but
Yeah.
now the mutation goes to the humans.
Yes.
So that is really something scary. So what are the
Yeah.
symptoms of the virus? How does it actually begin to manifest?
So before we talk about the symptoms, I think it's important to talk about how this virus is spreading among
Thank you.
us. So the mechanism of spreading is called via respiratory droplets. And these are mucus or fluid that's produced inside of our lungs. So let's say when we cough or sneeze, these droplets are brought outside of our body. So if someone is getting a direct transmission, let's say one of those droplets ended up in your mouth, your nose, your eyes, and then enter your lungs, that's a direct transmission. Sometimes these droplets can kind of remain just kind of floating around in the air, and then you ended up indirectly breathing it into your body as well. So once the virus enter your body, one interesting thing about the coronavirus, the reason why it gets its name is because outside of the virus, there's all these proteins that make it looks like a crown. So when the virus enter your body, it uses these protein to match with the receptor on your cells, kind of like the key and a lock. And
Mhm.
then after unlocking these keys, it will enter your cell and start uh, using your cell as a replicating machine, producing more copies of its own virus.
Mm.
So there is this thing called the incubation period, and is defined as a period of time where your body, the host, become a replicating machine for the virus, but you do not have any symptoms. So for this particular virus, we're thinking that the incubation period could be sometime between 2 and 7 days. We don't have a
Mm.
lot of clear definition yet, but that's the time frame that we think, from the time you get infected to when you start showing symptoms. So the symptoms could range, it has a very wide range of symptoms.
Mhm.
Some people might have very mild symptoms, could be neglectable symptoms. Some people could start having fevers, cough, sore
Mhm.
throat. Sometimes you could have gastrointestinal symptoms such as abdominal pain or diarrhea. And then,
Diarrhea. Okay, I
right,
heard about the
right.
diarrhea 2 days ago, actually. I didn't know
Oh,
that
okay.
diarrhea was part of it.
Yes, abdominal pain and diarrhea, nausea, vomiting. A lot of the common cold virus can cause GI related symptoms.
Okay. GI
Yeah.
meaning gastrointro.
Intestinal, yes.
Yes, okay.
Sorry.
No, I know,
Yeah,
I'm not a
no,
doctor,
it's
but
helpful.
yeah, for those who don't know what GI is,
Yeah, thank
fantastic.
you.
Yeah,
Yeah.
so that is brilliant. That has been brilliantly explained. So what should
Thank
one
you.
do if these symptoms develop?
So I wish that we could be more prepared in terms of testing, but we don't have a lot of testing right now. So what I've been telling my patients is that we need to assume everyone has COVID-19.
Mm.
So whether you have mild symptoms or you start having a little bit of fever, a little bit of body ache, you should always try to isolate yourself because that's the only way that we can minimize the contact and start, you heard a lot about the term flattening the curve.
Mhm.
We need to stop the spread of this virus. So isolation is one of the way, um, because sometimes you could be the one having the mild symptoms, but the next person that you might spread it to might not be so lucky.
Mhm.
And I was going to add to earlier regarding the symptoms is that some vulnerable population might experience the other extreme range of the symptoms, which includes um, ARDS, which is acute respiratory distress syndrome. And to explain that is basically your immune system try to fight this virus, and it causes this overwhelming inflammation in your lungs that prevent your lungs from performing the way that it should, which is bringing in
High
oxygen into
capacity
your
for
body.
oxygen. Yeah.
Exactly. So those are the people who start having shortness of breath, severe fevers, or having even other organs start shutting down from not having enough oxygen.
Oxygen.
Right. So those are the people who need to be treated in the hospital.
Okay, so
Yeah.
who are those that are really at risk? When I read everywhere and they say vulnerable populations. Who would you term as the vulnerable populations?
So in terms of contracting the virus, I would say everyone is at risk at contracting the virus. In terms of having severe symptoms, and I think that's the vulnerable population that you referring to, are the elderly, because older folks tend to have more underlying conditions. They might have already had hypertension, diabetes, maybe some lung issues, maybe some kidney issues. So people with
And for
any other
those of us that have
conditions,
had cancer.
you're right. Yep. That because with patients who've had cancer or even under cancer treatment, their immune system is not as strong.
Mhm.
Yeah.
Okay.
But the thing is, this virus is so new and we are learning about it every single day. At the beginning, they said that there is the elderly and the people with pre-existing conditions, but
Mhm.
they also start seeing a population of the younger folks, getting into the hospital, getting onto the ventilator and having more severe symptoms. So I'm trying to tell my patients not to take it lightly, even if you're young and healthy in general. Besides the fact that you could possibly spread it to your more vulnerable family members, you yourself, we can never say that, oh, I'm young, so I'll be fine.
Yeah,
Of course, the
yeah.
hope is of course, no one will get it, but once you do get it, it's difficult to predict what type of symptoms you have.
Mhm.
Right.
And so in order to predict what kind of symptoms you have, or if you have any symptoms at all, testing is the key to knowing that, isn't it? So that is whether it's being in isolation or being in a quarantine. So when should one get tested? When exactly should one get tested? And for example, where we are, where can one get
Yes.
tested? Do
Yeah.
you test where you are?
Mhm. That's a great question because since the outbreak, we are being in touch with a lot of our patients, and of course, everyone wants to know the answer. Everyone wants to get that test done, either because they have symptoms and they were afraid that that's what they have,
Mm-hmm.
or it's for the peace of mind as well. And like I mentioned earlier, I wish that we're more prepared and that we do have enough testing supply to test everyone,
Mm-hmm.
but we don't. So from the beginning, I mean, a lot of these process that we're following has changed a lot. Um, but like I mentioned earlier, we told everyone to assume that everyone has COVID-19. So let's say a patient of mine call me and say, hey, I'm starting to have a little bit of sore throat and cough. I will talk to them and assess their condition, in a more tailored type of way. So if they're in general a healthy person, don't have pre-existing condition, and their symptoms are considered mild, I would say let's quarantine you, let's keep you away from your family members and everyone else, and then just monitor the symptoms. I wouldn't jump onto testing at first. Because a lot of us can kind of get over the virus by supportive care at home. Just try to eat nutritious food, try to get a lot of rest, drink a lot of water, and monitor your symptoms. If you have a little bit of fever, you can take Tylenol. And of course, one of the monitoring is that seeing if your body responds well to Tylenol. Let's see if
Mm-hmm.
the fever comes down with taking Tylenol.
Mm-hmm.
Um, Now, let's say in a day or two, when people started getting better, then maybe testing is not necessary at all for these folks. But if you get worse, if you started having symptoms like shortness of breath, um, then we'll change our course of action and decide whether we need to send these people to the hospital to be managed further. So we do have a shortage of testing, so that's why we don't just test people to know whether they have COVID or not. And this is because in medicine, we try to ask ourselves a lot, if we have that piece of information, what would we do differently? So for these folks that are young and healthy and have mild symptoms, we can send them to test, we can use that testing kit on them. But if at the end, we're still going to send them home just to kind of get rest and supportive care at home, then we would rather just do that from the beginning.
Yes.
So for our institution up here in Central New York, our hospital have 2 campuses, and they built up 2 outside tent. And these are they call it the respiratory triage tent.
Triage.
People can start coming in, or maybe they get sent by their primary care doctor after talking on the phone with them. They will have their temperature taken, basic vitals taken, and then the provider in those tent, the doctors and nurses, will decide whether they need to be swabbed or not. So similar to what I just explained, if their symptoms is mild, they might get swabbed for testing and then sent back home to look out for the result. If these people started having, let's say, low oxygen level when they're being taken in the tent, they'll be sent into the emergency room for further management. And further management could include taking a chest x-ray, doing more blood work, monitoring them over a long period of time to see if their oxygen level dropped. And then the next step would be, are we keeping them in the hospital being admitted, or we're sending them back home?
Okay.
So lots of steps involved.
Lots
And
of steps, but
yeah,
it's good that at least these are processes, because when I hear them say, oh, there are no more testing kits available, or it's limited, and when we know that testing is very vital to be able to know who should do what, and where, for that matter, and this is giving a lot of people that I know cause for concern, to say, listen, I'm having the symptoms, but they say that there are no testing kits and all that. So that is scary.
Yeah, because the thing is, I can totally understand how this could be very confusing from the patient's point of view. So I would say, if you have a primary care doctor, if you start having symptoms, anything that worry you or your family, give them a call first. Don't try to show up at the doctor's office. Call. I think a lot of the primary care workforce are doing telephone visits or even video visits with their patients.
Yes.
To kind of assess, just kind of take a look and see how they look. Do they look blue? Do they cough a lot? Do they look toxic? And then the next advice could be, hey, whether come in or stay at home and continue to monitor. Because another thing is, coming into the ED, coming into the doctor's office is not without risk, without exposing yourself to sickness. Like if you didn't get sick before and you try to come in and spend X amount of time in the waiting room and exposed to other people, that could be a risk as well.
Yeah, that's what's been keeping me from going to have my port flushed, because it's
Yeah.
risky, right? So one has to wait until all this happens, but I hope it doesn't have any adverse effects, because I'm like a month out,
Yeah.
So it's been okay for now, but I know that very soon I will have to go. What do you
Yeah.
think as a
So
doctor about flushing my port? And
I think you should have your port flushed. And another thing is, similar to other activities that people absolutely must do, such as obtaining food. I mean, we try to advise the healthier, younger folks to help out the elderly or the people with more vulnerable conditions
Mm-hmm.
to bring them food and medications and such. But if you must come out of your home to obtain certain things, then I would say, keep yourself protected. Wear some type of covering, either fabric mask or surgical mask, and keep your distance.
Yeah.
And once you get to your doctor's office, like in your case, you must have your port flushed. Then the healthcare providers do know how to protect themselves and you. But while you're en route, you gotta try to maintain all of these precautions.
Yes, indeed. Yeah.
Yeah,
I have masks, the proper type and all that. So,
yeah,
yeah, I'll I'll have to prep myself up before going.
yeah, yeah.
There's a lot to
It's
consider.
difficult.
It's
It's
difficult.
very it's very different now.
Yes,
And
it is.
and the little things like this can really stress people out.
It is stressful just thinking
Yeah,
about. So,
yeah.
could you tell us what the actual process of COVID-19 testing entails?
Yes. So right now, the test that we have is called the nasopharyngeal swab, and that involves a small plastic Q-tip type of device that we insert through the nose to the back of the nose on top of the throat in
Nose
order
to
to,
the back.
right, right. So if you started looking these things up on the internet, there might be some pictures or even video of how it's done. It could look a little bit uncomfortable, because they need to insert that device into the right location in order to minimize false negative test. So that's where the samples need to be collected, is way back there.
Yes, yes.
I could see that a lot of people says, if
It's
you try to avoid
necessary.
having that test done, please stay inside.
I'd rather have that done. It's
Yeah,
necessary. Mm.
yeah,
So
yeah,
so that swab that you put to
yep,
the back of the nose, the nasal cavity, right?
yep.
So that's
So it goes in
extracted.
through the nose, but it needs to reach the back of the throat, nasal and the pharynx. um, so it need to go in a perpendicular angle to
Yeah.
reach the back. Yeah.
Okay. Yeah. Yeah. I've seen certain pictures of it, and I'm like, I'm going to have to ask Dr. Natalie about this because.
So it's uncomfortable.
Mhm.
But people have had it done. Um, and then we do have different type of tests. In the beginning, the test could take a little bit of time to come back, because there's only certain place that process the sample.
Mhm.
We're progressed towards having more rapid testing done. Right now, we've moved toward testing people for antibodies.
Mhm.
And this effort is to kind of have an idea of people who might have been exposed or had coronavirus but never had symptoms, or maybe have mild symptoms.
Wow, that is something.
Yeah. So the antibody testing is through the blood.
Mhm.
Yeah.
Okay. So, for you, health professionals, what's happening now? Are you getting all that you need in terms of your PPEs? Is everything seamless, or do you have to go way above trying to keep your patients safe? What are you doing to flatten the curve, especially in your institution?
So this thing has changed a lot since it first began. Um, and there's a lot of discussion. In fact, as part of the being chief resident, we meet with our program director on a daily basis just to kind of keep each other in touch and discuss various solutions for any concerns we might have. And the
Mm-hmm.
conversation on PPE comes up a lot,
Mm-hmm.
because even the recommendations from the CDC changes quickly based on the availability of PPE.
Mm-hmm.
And I'm sure you've heard about By the way, PPE is personal protective equipment.
Everybody knows that now.
Yeah,
Everybody knows what PP is, so I didn't even
So,
bother.
so that involve, you know, a gown, a mask, eyes covering, and sometime hair covering. Um, Depending on the situation, maybe not all pieces are required,
Mhm.
but I know the one piece that everyone talked about a lot is the N95 mask, um, because you know that's the one piece that tend to be the most protective, especially for healthcare providers. Um, so we do have the equipments that we need, especially for when we are taking care of PUI, which is person under investigation, or confirm COVID positive patients. So even when it comes to taking care of these patients, there are various criterias. And, you know, I think at some point we need to mention that the conversation is happening on the 28th of April
Oh, really?
because what I'm
Yeah.
about to say might change, you know.
Okay.
Uh, so right now we wear N95 when we are in contact with PUI or COVID positive patients during an aerosolized procedure. And sometimes we give these patients treatment procedure via mask that help their lungs, but these procedure can in turn cause the respiratory droplets to become aerosolized, so it could be dispersed into the air.
Mhm.
So any healthcare providers that is in contact with the patient during these procedures will need to wear protective equipments, and particularly the N95 mask. Um, for family medicine, we also do obstetrics. And so the second stage of labor and pushing or delivering a baby is considered an aerosolized procedure. So during these time when we go into the room to deliver the baby or push with moms, we also equip ourselves with N95 mask. The way it works at our institution right now is when you put an N95 mask on, that should be the one that's in direct contact with your skin, and it needs to have a proper seal. We all have our size tested to make sure that the size is
They fit properly.
it fits properly correct. And then we have a regular mask over our N95. And this is one of the effort to help conserve the N95 from having droplets landing on it from the outside, because we have every intention to reuse them. And then we have our eye covering, and we have our regular gowns and gloves that we wear regardless when we deliver babies.
Hmm.
So those are the situations in which we completely, fully gowned up.
Yes.
Um, all of our patients who go into the hospital, especially for patient under investigation or COVID patient, will be given a mask to wear. And the mask can be changed according to the situation. If it gets soiled, and then if not, we'll try to kind of lengthen our PPE as much as possible.
Hmm.
Because honestly, we don't know, you know, as you could see, the curve in NYC is very, very stiff, and every aspect of the healthcare system is being overwhelmed. So we have to try to do our part to conserve as much as possible. For our N95 supply, at least at my institution right now, we wear it for either 8 hours straight, or when we put it on and take it off 5 times. And
Wow.
then yeah, so we keep them in our personal bag with our name on it. And then at some point when we exceeded all these measures for that mask, we send them downstairs to re-sterilize, and then they get sent back to us to use for one other time or one other set of putting on and off.
Hmm.
Yeah, and
So,
it's
so that means that they're reusable. You can use them how many times? And what is the
so
process of sterilization? You know?
the Yep, yep. So the N95 mask in a normal time is not supposed to be re-sterilized.
Mm-hmm.
But, we're not in normal time, and, we try our best uh, to conserve. So therefore,
Okay.
from what I've heard, the re-sterilizing process at our institution is using heat. I've seen other doctors and scientists try to use hydrogen peroxide vapors to re-sterilize them. Because, I mean, it's all about killing the organism on these equipments without messing with the integrity to protect.
Yes.
These equipments are made with very special materials, and we try
Mm-hmm.
not to, yeah. So
Yeah,
we don't want to just like throw it in our oven or anything, but
exactly. And,
yeah,
and they
yeah.
cost a lot. I mean,
Thank you.
the supply chain, there's a lot of money involved. So
Yeah,
one has to really conserve as much as possible too.
yeah. So there's a lot of worries that come with using these things. Um, of course, if we come into work and we really want to protect ourselves and our family or our colleague, and we have a choice, we would wear these things all the time, or not all the time, but as much as we possibly can to um, to minimize the spread. But we're trying to be very mindful with each time that we put these equipments on and off.
Um,
We try to minimize the amount of people coming in and out of the room at each time. So for example, our institution is a teaching institution. We have a residency program. So, sometimes we do group round. We round as a big group. We come in, we discuss with the patients and stuff like that. But now is we need to do a little less than that. We need to have a dedicated provider that comes in and examine the patient and discuss things with the patient separately, rather than 5-6 sets of gowns and gloves
hmm
and mask. So we
Oh,
gotta divide
wow.
and conquer.
Yes, exactly. Divide and conquer. And
Yeah.
you guys are doing a fantastic job, honestly. At 7 o'clock every evening here, we're always clapping and praying for you guys
Thank
because
you.
it's really overwhelming. It's
Yeah.
really overwhelming. Yeah. But at the same time, with all that you guys are going through, we read and we hear about a lot of you guys falling sick, being hospitalized, on life support, even while performing your duties. You
Yeah.
know, what as a daughter, as a wife, as a mother, what are your worries and long-term fears in this regard? What scares you the most?
That fear is there every single day. I think, probably since mid-February until now, I can't recall a day where we don't worry about this type of stuff. And of course, we're in a different time. We have meetings. We talk about this every day. We discuss this with our colleague every day. And of course, we come in and we take care of our patients every day. So that worry is there when we wake up, is there when we brush our teeth, is there when we, go to sleep. And I feel like one of the, like you mentioned, one of the more severe worried is to bring it home to our family. I live with my husband and my 2-year-old. Um, as of now, I'm relying on the fact that my husband is in general a healthy person, and that we don't have a lot of report of coronavirus affecting young children. But it's we don't know enough. So I try my best to kind of if I have a shift that involve taking care of COVID patients, or let's say I'm on L&D, delivering patients, then I'll try to take all the measures. So for example, I will come into the hospital, change into hospital scrub, change out of the scrubs before I leave. um, Hand washings is like
I
our
know.
hands are feeling like crocodiles
Oh,
asking,
wow.
you know, um, because we wash our hands so many times. And, this is not new. We wash our hands so many times even before the
This
pandemic, and
happened, right?
we do it even more. And then of course I try to run directly into the shower and wash off and put all the clothing that been outside to the wash. And all of these measures can be used by the general public, and
Hmm.
we recommend that people do. It's never too bad to be extra careful.
Hmm.
Wipe down all of your equipments, your telephone. If we use our phone a lot, our phones is actually one of the dirtiest items.
Dirtiest, I'm telling you.
Yep, yep. So what we do is sometimes we take the phone out of the phone case and leave the case in the car, and then just take the phone. Sometimes while we're at work, we can put the phone inside a Ziploc bag because we can still use it over a Ziploc bag, and then just change out the Ziploc bag. Um, and try to use earpieces. We don't have to press the phone onto our faces. Try not to touch our faces often. It's hard. It's very hard.
Yeah, we're getting used
Sometimes,
to it. We're getting
yeah.
used to it, but it's
Sometimes
difficult.
they yeah, sometimes they said, having a mask on is minimizing you from touching your face, but we find ourselves constantly adjusting the mask too. It's not the most comfortable things to wear mask all the time. Um, and and I mean, that's all we can do. I've seen a lot of healthcare providers, especially in New York City, where the hit was a lot harder than us up here, live completely separate from their family. And that is so hard. I mean, how could you not come home and hug your children? But this
Hmm.
is the extent that that some of the healthcare workers are going through, to kind of make sure they protect themselves and their families.
Yeah, it's
So
sad.
yeah. So when you mention flattening the curve, I think um, I think I have to kind of turn it over to the general public when it comes to flattening the curve. I would urge everyone, and I tell my patients this all the time, to kind of listen to um, the right source when it comes to seeking the information regarding the pandemic. I know that we're all on social medias, we're all on the internet, and we mentioned that there is good and bad things about the internet. With all these information that's so readily accessible, they're not always the correct informations all the time. So you can call, you can talk to your doctor, but go to sources like the CDC. Try to really look into the science behind why we're doing certain things. So one of the things that we have right now is to stay in. It's not easy at all to be stuck at home, and kids are not in school, and you're missing your restaurants
The
and your
usual
hair salons.
routine. Hmm.
Yeah, it's really not a normal situation, and I worry for everyone because I feel like things are changing so quickly, and it feels like everyone is being thrown into this new normal too quick, and we left it in to our own device to kind of cope with it at home. um, but you gotta try to help us out by following it, because um, every chance that you can contract this virus is could keep on spreading, and then these quarantine orders might extend even longer.
Yeah, and now that there's certain states that are thinking about relaxing their
Yeah,
you know quarantines or stay at home
yeah,
thingy. What do you think will happen? Because it's scary. We
yeah.
we read about so many well, there's something about the Spanish flu and how people died,
The
years
second
after
wave.
the second wave. So that's what
Yeah,
everyone is scared about.
yeah,
Some people think it's not important. No, it can't happen. But I think that there's still many people that haven't been tested. There's still many people who don't even know they have these things.
yeah,
And
yeah,
the winter is coming very soon. We're already
yeah,
in summer.
yeah,
It's
yeah,
coming. And
yeah,
So what do we do? That's the thing, you know?
I feel that, I worried for these reopening, because I feel like we need to reopen with a good plan. I absolutely understand when people feel like they've had enough of staying at home. They've had enough of
Yes.
this social distancing and not being able to do a lot of things that they normally do. But
Mhm.
but I don't think it's a good idea to, like, all of a sudden go back to normal, because we can't. I feel like even if restaurants are open more widely, we still need to maybe choose to take out rather than sitting at the restaurants. Still limit ourselves when it comes to going to the store, still trying to maintain distance. um, and you're right, I don't have the answer to whether there will be a second wave, but why don't we try not to have that be the case,
Exactly.
for everyone's sake?
Be
Because I
proactive.
yeah, because I feel like it's difficult to say, hey, use common sense. It's hard because um, there's so many different advice and sources that you don't know where to follow. Sometimes the orders that says let's opening up again and start loosening the quarantine policy tend to resonate with people better because they already feel like they need to go back to
To
um,
normal.
yeah, and not to mention people are itching to return back to work because of the financial hardship. It's
Absolutely.
it's very difficult. It's very difficult,
And
but
it's going to be very difficult
yeah,
readjusting because already we have been cooped up for so long, and
yeah,
it's like a toddler starting, baby steps
yeah,
all over again.
yeah,
You see certain cartoons that got
yeah,
me rolling on the floor, somebody sticking his neck out and then running back in again, because
yeah,
you're still scared what's
yeah,
out there.
yeah.
But as you rightly
I
said,
agree.
we have to be proactive and still not sit at restaurants, you know, still being socially distant, or
Yeah,
and
yeah,
keeping as hygienic as possible. What about us that, I mean, we use the trains. What's going to
yeah.
happen on the
The
subway,
public transportation
public
is a tough one.
transportation? And
This is very tough.
that is very tough. And like you rightly
We're
said, there has to be a plan in place before
Yeah, yeah.
relaxing these measures, you know.
So one of the thing would be to, right now we're doing antibody testing,
Mhm.
and there's not enough studies to say how long these immunity are lasting. Just because you test positive with antibody, that means you're probably exposed or have COVID-19 at some point. But how long will this protect you? Because
Mm.
if we are thinking about, I mean, coronavirus is definitely not the flu. But if we think about the case of a flu that's also a virus, people can repeatedly get the flu every season because of all of
Mhm.
these mutations. So having the flu doesn't mean you're protected from ever getting the flu again. So we're questioning similar concept with coronavirus,
Mhm.
because there's not enough study to say how long the immunity will last.
Will last. Wow.
Yeah, yeah.
So, what kind of change, what whirlwind of change have you guys had to go through to care for your patients during this time? And in your opinion, I'm not saying anybody else's, in your opinion, what do you think should be fixed as SAP in the healthcare system?
The
Your opinion.
the thing that make it such a whirlwind, and this happens, I feel like it happens everywhere, and obviously in certain cities that the outbreak are very, very heavy. I can't even imagine. Um, Everything is overwhelmed. The entire healthcare system is overwhelmed, from the supply to the well-being of the doctors and nurses and supporting staff, ancillary staff everywhere. The thing that made it the whirlwind is that it happens quickly and that we are not prepared,
Mm-hmm.
and that things are changing on a daily basis, if not like hourly. Um, we wish that, there's a lot of things in medicine that we know exactly what to do for our patients. Um, but there's so many uncertainty. The science community try to come together um, to try to somehow put together an algorithm that we could somehow follow. Like someone who comes into the hospital with COVID in New York City might come down and being treated with the treatment or the same process as someone in California, but that's different now. I mean, we don't have that in place because of how new this thing is. We each tried our best to support the patients to get them recover if they were to have severe symptoms. So these uncertainties is what stress
Mm-hmm.
us out a lot. We still don't even know, if everything that we're doing now is enough, and
Yeah.
we might continue to find out that maybe there's other things that we need to do, or maybe we need to change this. So for example, one of the things is, early on, we find out that maybe proning the patients help them more. So more and more places are trying to do that.
What did you say? Go back again. Proning the
uh,
patient.
Proning the patient. So when they have the respiratory symptoms, if we turn them over on their stomach,
Tummy, on their stomach.
facing downward, they
Mhm.
tend to do better. And the theory behind that is to recruit more units in the lungs called the alveoli to kind of help oxygenate the patient.
Wow. That's
Yeah,
interesting.
yeah.
That is interesting. Wow. So
So
I read that somewhere, yes, that they tend to do better on their stomachs than on the, I think it's because lying on the back kind of puts pressure on the lungs, right? In a
yeah,
way.
yeah.
Yeah. Yeah.
So even normally, our lungs have certain areas that are not working.
Mm.
If we lay on our side, might be because of the pressure or because the blood flow towards certain area, and that's normal. When we change position, that might change. But in these patients, when it comes to the overwhelming inflammatory process, we try to recruit as much of the lung tissues as possible in terms of helping with oxygen exchange.
Oh, wow. That's good to know. Hmm.
Mm.
So, as for me, I'm also, as you know, a mental health advocate as well. I've
Yeah.
done a lot of things in that regard, and I'm extremely worried about the mental health of those on the front line,
Yeah.
new health professionals and all that.
Yeah.
Recently, I posted on my wall about this, and I quote, "It seems the mental health care system is the least ready for a pandemic such as this." Do you agree with my view on this, or do you think that the mental health care system is in check? It's doing its best, or it needs a kind of you know push or change? What do you think in terms of healthcare professionals?
Yeah. So I appreciate, your thoughts, and I completely, absolutely, 100% agree with you. Um, there's actually many different pieces to your statement just now. I feel like even in normal time, the non-pandemic time, we struggle quite a bit with mental health. As a primary care doctor, we and especially in upstate New York, it's difficult to establish your patient with mental health doctors or psychologists that can help our patients. And since the outbreak, I'm in touch with a lot of my patients who in general are feeling well, staying in, not having symptoms, protecting themselves, but the mental health aspect of things is what being hit pretty hard. And we touch on it throughout our conversations today, is that it's just difficult to get used to this new normal. a lot of us are still trying to deny that this is our new normal. So it's hard hit on people who don't have pre-existing mental health conditions, and it's just equally as hard on people who might suffer from depression, anxieties, or other conditions all along. So, we do spend a lot of time on the phone with our patients. We cry with them, we pray with them, whatever necessary. We try to hook them up with their therapists and their psychologists, psychiatrists. A lot of these doctors are also doing telephone visits with their patients just to kind of keep in touch with them, making sure medications is available just like any other conditions. But yeah, I do see a lot more of my patients having concerns. Sometimes when I called on them just to check on their blood pressure, check on their diabetes, I always end with a conversation, hey, do you have any questions about the pandemic? How are you doing? How are you hanging in there? And, more often than not, the response, require us to have an additional conversations about this, because everyone is overwhelmed and everyone feel like they don't know. One side of it is that, hey, everyone is going through this, so maybe I shouldn't validate
Bring it
these
up.
feelings. Yeah, but it's there, and sometimes it's very difficult to process. So so that's the general population.
Yeah.
For the healthcare providers is multifactorial. There's so many, I feel like the populations of doctors and nurses and healthcare providers in general are, most of us are type A personality. Most of us feel like, maybe we don't need help. Maybe we can weather this through. Maybe but no, deep down, we are worried. We're worried for our patients, we're worried for ourselves, and we're worried for our families. So to be, in terms of what my institution is doing, there's a few hospital or medical systems up in upstate New York. They come together and they have this formal training for healthcare providers to be peer supporters. And I thought that was such a
That's
wonderful
awesome.
idea.
Oh, wow.
Yeah, because studies and data have shown that if the support comes from your colleague,
peers, your
your
colleague.
peers, exactly, people who are, shoulder to shoulder with you fighting this thing, to kind of discuss the fears and worries that maybe you won't reach out and voice to even your therapist. And it tend to be more effective that way. So I'm actually one of the peer supporters for all the residents in our
Oh,
program.
fantastic.
And I try my best to reach out to everyone, especially the one that's currently in the front line, and we just talk about it. We try to, I try to make it therapeutic for them, but selfishly it's for me as well, to kind of just to hear about their worries. And I think it's important to kind of, with this whole isolating ourselves thing, sometimes even when we're at work, it's hard to see the other person's face, can't even see what their expression is.
Yes.
We have the mask that's covering most of our face, and then we have the eye coverings and all that stuff. So I think it's important to talk, because we don't have a chance to talk while we're at work.
At all. At all.
Yeah. So I try to do a video talking and just sometime just listening, and hopefully it makes an impact. I heard about Dr. Lorna Breen in New York yesterday, and that left a very, very heavy, it was
Very heavy.
Yeah, because on one hand we have our colleagues who fall sick from COVID-19, but to lose a doctor to mental health, or we don't know enough about
A
what
doctor,
the
a
reason
healthcare,
why.
any other healthcare professional, because there's one I read about this young nurse, a guy who I think about 23 or 24, who committed
Yeah.
suicide with his dad's gun. You know, the dad was a
Yeah.
police, I think a retired police officer, and he just took
Yeah.
his dad's gun. So that's why this, you know, I said to myself, what the healthcare professionals are going through is
Yeah.
touch wood, is insurmountable. The only way is to have mental resilience. And I'm very happy about your initiative about peer support, because with you guys standing together, um, each one knows what he or she is going through and can actually relate than
Yeah.
to go talk to a psychologist, a psychiatrist. You know, they wouldn't be
Yeah.
able to understand what, you know,
Yeah.
the professionals are
In
going
a
through.
way, this is alleviating the overwhelming numbers of patients that the psychologists, the psychiatrists have
Hmm.
to deal with as well. Um, we try to save that for our patients, but
Yes,
um, I feel like at some point in the future, the healthcare providers might have PTSD about this. I don't know how long this is gonna last, and once it's all said and done, um, we might need even more support because um, I've I read every day about these providers in the cities that are the kind of things that they see, the kind of things that they have to deal with, the extreme measures that they have to take, just
absolutely.
just to do their day-to-day job. And
Yeah.
that's
I mean,
yeah,
just to live up to the Hippocratic Oath,
yeah,
it's difficult, you
yeah,
know, and like you rightly said, um, PTSD is going to play a huge role in the lives of, you know, healthcare professionals going forward, because a lot of
yeah,
them are, there's a lot of burden, you know,
yeah,
and many cannot even talk about it.
yeah,
They're
yeah,
on autopilot. Yeah,
yeah,
wake up, go to work, come back, that's it. Wake up, you're too tired to even communicate with members of the family,
yeah,
because it's a crazy routine.
yeah,
So that's why I said the mental health care system has to be revamped, you know, and more inclusive as well. And you know, mental health is some kind of stigma. I
yeah,
got to know when I was doing a lot of work regarding mental health, and most people don't like to talk about it. They're having issues, but they don't.
yeah,
And so you just see somebody just, you know, say hello to you, smile with you, and everything, and the next minute, you hear that, oh, he committed suicide. What?
yeah,
What happened?
yeah.
So these
I
are,
I think that's very concept of not just go by how people look or how they
yes,
behave. Um, just in terms of the concept of simply checking on your friends, your family, your peers. Um, Maybe just calling them up or text message them and say, "Hey, how you doing?" is not enough.
it's not enough.
Yeah, sometimes you have to reach even further, and that extra mile that you go will make a difference, but it's hard. People don't even know how to do that,
Yes.
you know? Um, Part of us feel like, okay, I'm going to check on XYZ. And as soon as you hear them saying, oh, I'm fine, okay, so we're good, we're fine,
Yeah. Yeah.
you know? But,
But I'm
but
fine is a mask to
yeah,
everybody. And
yeah,
except I dig deeper, I
yeah,
wouldn't know until I try to draw out that you have to be able to, like someone like me, I am very sensitive. So even if I ask you, Natalie, how are you today? Oh, I'm fine. Of
yeah,
course, I would be able to pick up certain things. One, you don't
yeah,
want to bore me with your problems. You
yeah.
understand?
Where
Two,
do I begin?
where do I begin? Or three,
Yeah,
you wouldn't even understand
yeah,
if I told
yeah,
you. You
yeah,
wouldn't understand. So why bring it up? So
yeah.
that kind of pushes people away from voicing out what they're going through. Yeah.
Yeah.
But that initiative, keep on at it, because as you said, it would help and alleviate the pressure that the psychologists and psychiatrists are having to deal with right now.
Yeah.
You know,
Yeah.
no
And
peer
whatever
support
little
group.
things that we could do to help our colleagues,
Yeah.
we try to, part of the chief residence duty is when we put together a schedule, work schedule for the residents, we try to, have a lighter period so people can at least have some time to recuperate.
Mm-hmm.
And I feel like things like that makes a big difference.
It's more than whatever you think. It's more than a big difference. It's a lifesaver. It's a
Yeah.
lifesaver. You don't know with that program how many lives you may have saved just by that. So yeah, that's so interesting, Natalie.
Thank
So
you.
what advice would you give to those who have been tested positive? Um, and also, that's for the patients, and also your advice to people like yourself who are going through this COVID-19 problem. What advice would you give to them going forward?
So for people who might have gotten tested, and if they get tested positive, chances are they must have been treated or managed by a healthcare professionals already,
Mm-hmm.
or have gotten advice about how to kind of support themselves getting through the recovery process. So continue to maintain the distance, especially with your family members who might not have symptoms or might not gotten sick. Still continue to try to protect them. And for yourself, um, like we mentioned earlier, the immunity, we don't know how long it lasts. Hopefully it lasts for a long time and that you're protected, but please don't, let your guard down, because we don't know if you can still get reinfected. And if you do get reinfected, which strands of the virus is going to get you sick? Will it be better? Will it be worse? First time, maybe you have mild symptoms, but the second time with the mutated form, we don't know. Um, for us healthcare workers, what I've seen so far is from myself and our colleague. I feel like the worry is not going to leave us for a while, but everyone wake up and everyone show up at work. We get a lot of love and support from everyone, from the community. We've received food and a lot of um, token of appreciations from everyone, and we take notes of all of it. It sometimes make our whole day. It's the kind of thing that we hold on to keep going. So just try your best to protect yourself, to protect your patients, to protect your family, and hopefully we'll get through this if we keep this that we're in this together in mind. um, from me personally, I'll keep being an advocate and keep educating my patients, just so everyone is kind of not just aware but clear about what to do. um, things things might change, a lot, like I mentioned, a lot of things that we say or discuss today might change tomorrow. We
Sure.
might not to wear something else different than just a mask, or maybe we don't need it at all, hopefully.
Mm-hmm.
um, but but just keep having a conversation with your healthcare providers, because we try to be as up to date as possible with all these changes, and we'll be able to tell you what's the best course of action. Call them up first, talk to them on the phone before trying to show up at emergency room or doctor's office, because that's another measure that keep you from contracting illness. um, and we'll try our best to take care of you.
Thank you so much, Natalie. So,
You're very
uh,
welcome.
last question. If you
Yeah.
would you go down this path again?
In a
I
heartbeat.
know, I know that answer.
Hey, coronavirus cannot change us.
Cannot change.
No, we wouldn't let us change, let coronavirus get to us. It's scary, and it's gonna take a lot. It's gonna take virtual hand holding and hugs, and the support, the emotional um, well-being to be there. But I think we'll do it. We'll be able to get through it.
I'm
Or at
sure we
least we
will.
need to hold on to that hope in order to get through all the days.
And with people like you, definitely it makes everything easier.
Thank you. I appreciate that.
For those watching, Dr. Natalie Hua played a very important role in my journey, and you're going to be hearing much more about her very, very soon. So thank you, Natalie, for all that you
Thank you
did for
so much.
me and the rest of your team at the Brooklyn Cancer Care. You all know that there's something coming up very soon. And of course, you're part of the story.
Thank you.
Okay, so
I'm
thank
so
you so
glad to be
much,
part of the
Natalie.
story.
Thank you
Thank you.
so much
I
for
really enjoy
finding that
talking to you.
always for finding the time. So let me sign out, then I'll sign you out formally, okay?
Yeah.
So, my dear audience and friends, thank you so much for listening to myself and my very dear friend and sister and daughter and everything, Dr. Natalie Hua, who has been willing to share her story about the healthcare system, about being on the front line, and her advice to us. Very soon, this will be up on YouTube, and you guys can have a good listen to it. Thank you so much for the support of all the platforms. And once again, see you in the next episode. Wishing you love and light. Ciao, ciao. Thank you so much, Natalie.
No problem.
Love to your family. Talk to
You
you
did okay.
soon. Yeah,
Thank you.
fantastic. Thank you.
Thank you so much.
Bye.
Bye bye.
Blessings. Bye.